Hi guys, my name is Dimple. Today I'm going to talk to you a little bit about Lynch syndrome. Lynch syndrome is a genetically inherited disorder that increases the risk of many different types of cancers, especially that of the colon. Women who have been diagnosed with Lynch syndrome have a higher chance of getting cancer of the ovaries or the lining of the uterus. Lynch syndrome runs in an autosomal inheritance pattern, which means if one parent carries a gene mutation for Lynch syndrome, there's a 50% chance that the mutation would be passed on to each child. Genes carry DNA. DNA carries instructions for every chemical process in your body. When cells grow and divide to make copies of their DNA, it is normal for some minor mistakes. In people without Lynch syndrome, the cells have mechanisms to realize a mistake and repair the cells, but the cells of the people who inherit Lynch syndrome lack the ability to repair these minor mistakes that occur. Not everyone with Lynch syndrome will get cancer, but an accumulation of minor mistakes can lead to increasing genetic damage and can cause cells to become cancerous. People with Lynch syndrome are more likely to get colorectal cancer and other cancers such as endometrial, stomach, liver, kidney, brain, certain types of skin cancers at a younger age, especially the age before 50. People with Lynch syndrome may also have benign growths in the colon called colon polyps. Now I'm going to tell you some of the statistics that I found out about Lynch syndrome. In the United States, it is estimated that 1 in 279 individuals have a gene mutation associated with Lynch syndrome. There are a number of inherited syndromes that can increase your risk of colon cancer, colon or endometrial cancer. But Lynch syndrome is the most common. Doctors estimate that around 3 out of 100 colon or endometrial cancers are caused by Lynch syndrome. Lynch syndrome can also be known as hereditary non-polyposis colorectal cancer, which can sometimes be asymptomatic, which means it presents with no symptoms, or it could present with rectal bleeding, stomach pain, and cancerous-related symptoms like unexplained weight loss, fatigue. Monitoring of Lynch syndrome often involves colonoscopies every 2 years from as early as age 25 or from an age 5 years younger than the earliest colorectal cancer case seen in the family. Screening has also shown promise